Okay, so this is Dr. Kelly here, and I want to make sure we take you through what it means to shift your hips when you're doing a quadruped exercise or a bird dog exercise, and how it can look when you're doing it wrong. So Miss Lindsay has volunteered to do this. There we go. Cute little booty here demonstration. So first what we're going to do is show you what it looks like to do it wrong. So go ahead, Lindsay, and just show what it looks like to do maybe just a leg lift with your shifting. See how she shifted the hip, or you could do a hip hike. All these are wrong. So she did not maintain, go back to neutral. She did not maintain neutral spine there. The cup of water that she could have had on her back just slid off to the side. So we have to make sure that we have no hip shifting, which means we have to turn on all the glute muscles, particularly the glute med, when doing this exercise. So some modifications we can do if we're having trouble with this is to take the patient to the side of the mat. So go ahead, you're going to slide your left, a little over to the left, your whole body. So your knee's going to be off the mat a little bit. Yep. And then if you have a surface where you can slide your knee, that's what I tell you to do. But if you don't, you could just kind of raise your knee off the ground an inch and just go ahead and slide your foot back. So it's whatever feels comfortable to you, but to feel whatever feels comfortable to you, whatever you need to do. Lindsay's raising her knee off the ground and actually sliding the foot, which just looks great. So go ahead and keep doing that, and she's gonna feel that right glute turn on as she does that. Everything's maintaining neutral spine. So the biggest thing I see would be to kind of hike and drop here when you do it. So yes, or that. That happens a lot because you've lost your glute med. So again, go back to normal. Nothing should move here. So one more time. Perfect, nothing moved. And she's using all the glute as she raised that leg back. Now show what it looks like for a full leg lift correctly again. Perfect, again, nothing moved. So we want you to get to this point. Okay, so from here, if we're still not feeling it or we need some more tactile feedback, we can put Lindsay against the wall. So go ahead, yep. And then she's gonna get about an inch from the wall with that hip. So her right shoulder might be even touching the wall, and that's totally fine, but we want about an inch space between the wall and the right hip here. Now, as she does this, she's going to go ahead and get that proper positioning and raise the left leg and make sure she does not shift or move into the wall, and then exhale back down. So she did a really good job. If she, all this is for tactile feedback. So you know for yourself if you're shifting or not, if you cannot feel it. But eventually we want you to get to the point that if you can feel this, you can move away from the wall and start to do, have that body awareness yourself. Good place to start though if you need it to use the wall. So.